We're learning more information about Indiana's plan to increase communication between long-term care facilities and families. Governor Holcomb said today the state will still not release the names of long-term facilities with coronavirus cases. As CBS 4's Kelly Rinke reports, it's information families desperately want.
More than 1,500 COVID-19 cases are inside Indiana's long-term care facilities, but Indiana is not naming the sites with the virus.
It's very frustrating. You want to know that so you can make educated decisions on what to do with your family member.
Judy Spear is the power of attorney for her 96-year-old dad, Sam. He's been staying at the assisted living portion of Rosegate in Indianapolis. This week, he tested positive for COVID-19 and was moved to a hospital.
He's very tired. He's not eating well, having some irregular heartbeat.
She claims she had asked the facility about the total number of COVID-19 cases there.
The corporate office had advised them to not give that information out. She did, after a discussion, she did say she would check with them and she will call me back later today.
Spear tells me someone did call her back and told her the number of cases. She was very grateful for that info. Today, Governor Holcomb said he will not direct the state health commissioner to release the names of facilities with cases, even though on Tuesday, Indiana's state advocate for residents of long-term care facilities told us that information should be revealed.
And the reason is because we respect that private business, that nursing home that is operating under our regulations, and that's where the relationship exists.
Right now, state officials and the advocate for residents are working on a plan to improve communication.
In addition to the residents that are in that facility, that for those people who would be coming to a facility as a new admission or as a transfer, that they also need to know the status of the facility in regards to COVID.
Here are some details on that plan. The state will instruct facilities to reach out to residents and families to provide updates on how it's handling issues with care and staff shortages, general info about COVID-19, number of residents who have tested positive, and number who have passed away due to the virus. Woody Myers is the former state health commissioner. He's also running for governor. He believes the names of facilities with COVID-19 should be released.
I think that's essential information. Other places are doing it. I don't see any real legal restriction on making that information available. I'm not a lawyer, but if other places are doing it, I hope we can then quickly do that here.
We expect to learn more about the state's plan on Monday. In Indianapolis, I'm Kelly Rinke, CBS 4 News.
American Senior Communities operates 34 facilities in central Indiana, including Rosegate. They say they're having trouble getting the number of COVID-19 cases in their facilities. In a statement, the company told us, quote, "Transparency and communication with families is important to us. Should a positive COVID-19 case occur, all residents, families, and employees are notified." The company did not share coronavirus numbers with CBS 4.